For me, one of my biggest passions and something I was committed to even while I was in medical school is I want to make a difference in my community now. Between the summer of my first and second year of medical school, I went down to New Orleans for a research internship that had pop-up clinics for the homeless, but also had a separate program that focused on providing care for human trafficking survivors. One of the key things of why I'm so passionate about raising awareness for human trafficking is actually from my first survivor encounter. The lady was pregnant. She had just been extracted from her trafficking situation, and she looked at me in the eyes and she asked me, "Do I deserve care?" I believe that everyone has a form of intrinsic value. I believe everyone deserves the same form of care and respect. So Red Flags to Freedom is a nonprofit that I started in August of 2021, and it came to fruition after seeing the gaps of how I, as a future physician, will care for survivors of human trafficking. So our human trafficking awareness efforts are survivor-centered and really shifts the perspective of how we teach this education. Hope's Clinic is one of EVMS's big CEL initiatives, and it's a student-ran free clinic. Their key goal is to focus on care for the underserved in Hampton Roads. So it's the main general Hope's Clinic, which is primary care, and then we have a lot of specialty clinics.
It's a whole different kind of care with survivors of human trafficking, domestic violence, and acute sexual assault.
Blue Heart Specialty Clinic is a clinic that started almost 2 years ago, and it was really in response to meeting with a lot of the local organizations where there wasn't a clinic for survivors of human trafficking, domestic violence, or sexual assault. So it is a specialty clinic from Hope's that meets every month that is focused on providing care for those patients. Red Flags to Freedom provides the training that every student must do in order to be a volunteer at Blue Heart Clinic. So one of the reasons that Blue Heart was able to become a clinic in less than 3 months is because of the amazing infrastructure and protocols already set in place in the Hope's Clinic. So we can't do this without the support from EVMS.